Have you ever gone to the dentist and the dentist tells you that you might need a root canal on your tooth? Have you wondered, what is a root canal? What happens to my tooth during a root canal? Well, 15 million root canals are done each year, making it one of the leading and most common restorative procedures done in the dental field. Approximately 41,000 root canals are done a day. So if you're wondering about what happens to your tooth, chances are you're not alone. In this speech, I'll be telling you all about the process of a root canal and the different steps and why we perform them. The root canal is a dental procedure involving removing the pulp and the nerves from the tooth. Before a patient is referred to an endodontist, who is a root canal specialist, they go through many diagnostic tests that can tell us whether or not a root canal is the proper treatment for the tooth. The first step is to take diagnostic radiographs or x-rays, and we can usually tell by looking at the root of the tooth whether or not the tooth needs a root canal. These are the most popular and common diagnostic tests because it usually tells us the most. There are other tests such as palpation, where we palpate the soft tissues below and around the tooth to check for abscesses that may be filled with pus. An abscess is just a pocket of pus that's near the root or the apex of the tooth. And this is caused by either your tooth moving around in its socket or from poor dental hygiene. There's the percussion test, where we use a hand mirror and we tap on the tooth, and if you feel it and it causes sharp pain, chances are there is a root problem. Mobility is another test where we hold the tooth between our fingers and we try to see if it moves at all. If it moves more than 3 millimeters, we can't do the root canal because the tooth isn't properly in its socket. At that point, we would have to extract it. There's also the cold test, where we place a piece of ice or dry ice on the top surface of the tooth, and if the tooth doesn't respond, that means that the tooth is necrotic. Another test is the heat test, where we take a certain material, we light it on fire, and then while it's still hot, obviously not on fire, we press it against the tooth. If the tooth responds to this heat, it is a bad sign and it may need a root canal. So when you get to your endodontist's office, our first step from then is to use a high-speed handpiece to get through the first 2 layers of the tooth. These layers are hard, and the canal for the root is a bit deep into the tooth. That's why we use the high-speed handpiece. This is done meticulously so that the dentist doesn't go too far and destroy the canals. The next step, once we gain access, is to remove the pulp from the tooth. This is the lengthiest part of the procedure because we can no longer use a high-speed handpiece. As I said, the canals are too tiny. They're too viable. We can't risk destroying them. So we use small files that sort of look like pins that you'd use while sewing, and they have rough edges, and they are placed into the canals, and in layers they're just taking out all that necrotic tissue and decay and all the nerves and pulp. They pull them out in a way that where it doesn't destroy the canals and it doesn't affect them in any way. So this is why it takes so long, because the files are very small and it can be hard to get those canals completely emptied out in a short amount of time. It's important that we don't reach the bottom of the tooth, because at the bottom, or the apex, as I said earlier, once you get to that bottom, you're going to reach the socket and the bone that the tooth fits into. And we don't want to hit that, because then it basically opens a door into your bone and your socket. So periodically through this step, we will take x-rays to see how close the dentist is to the apex of the tooth. Once we get to the point where all the decay that we need out is out, it's important that we irrigate the canal. Irrigating is done so that we can remove any debris, we can disinfect the canal, and we can also remove any necrotic tissue that may still be there. We use a solution called sodium hypochlorite, which is mixed 50-50 with water, loaded into a special syringe, and then injected into the canals. When we insert the temporary material, it's important that no decay forms underneath. We want this to be a final step for the tooth. We don't want to have to take the material out and have to get rid of more decay. We want it to be done. So it's very important that we irrigate the canals. The next step then is just to place the temporary material. The temporary material is temporary. Within the next 2 weeks, you'll return to your regular dentist, so that he can put a more permanent material onto the tooth and prepare for your tooth to receive a crown. The temporary material that we use may come out within the next 2 weeks if you're brushing too hard or you chew something sticky. So it's important that you stay away from sticky foods or anything that might take out that temporary material. It's important also that if that temporary material falls out, that you call your dentist immediately and have them replace the material. You can buy a temporary material at Walgreens or Walmart, but when you do that yourself, you're not sure if the canals are still completely disinfected. If you do not replace the temporary material right away, you will lose the tooth because decay will form inside the canals. The canals will be open at that point, which will cause food impaction. You won't be able to brush down in the canals, and they will get decayed, and it will happen fast. So it's very important that you get back to the dentist right away. After the procedure, your tooth still may be sore for a few days. That's pretty common. If it gets to the point where it's so irritating that it's distracting you from eating and sleeping, make sure you go to the dentist, and we can make sure that there's nothing going on in the tooth that we may have missed. Be careful when you brush and floss on that side. Like I said, we don't want to remove that temporary material. I suggest brushing with an extra soft toothbrush or a child's toothbrush, which will be enough to clean the area, which is very important, but not enough to rip out that temporary material. Which brings me to my next point. Once you get that permanent material put in by your regular dentist, they will need to treatment plan a crown. A crown is basically a cap that looks like a tooth that's placed on top of your tooth. They will use a high-speed handpiece to shrink your tooth, to take off some of the edge of that tooth, and then they will create a crown that is perfectly fit for your tooth and that looks like your other teeth. It'll be the same shade, it'll be comfortable. This is extremely important that you get a crown, because otherwise the tooth it's not as strong as it once was. So you might have problems with keeping it in the future. What we want most of all is to keep that tooth. That's the whole point of root canal therapy, is to keep the tooth and prevent you from losing it. So it's extremely important that we do all that we can to make sure that you do keep that tooth. Now, crowns can be costly, but all you have to remember is that they last a lifetime. You get a lifetime with this tooth, a lifetime of chewing on this tooth, a lifetime of that comfort of just having your own tooth. If you don't get a crown, you will lose the tooth. It won't be able to withstand that amount of chewing pressure and everything else. So it's important that you get the crown. So this is the process of a root canal. I have explained each step and why it is important. And just remember that the best way to avoid a root canal is to maintain healthy oral hygiene. Brushing twice a day for 2 minutes, flossing once a day, it's extremely important. It can save you money. and prevent you from having operations such as this one and worse ones like extractions. And it can also prevent you from spending a lot of time in the dental chair. Alright, thank you.